Hello and welcome to DrugsPlus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. In this video, I'm going to discuss anticoagulants for the prevention of venous thrombosis. For a more detailed introduction to thrombosis, you can see my thrombosis video, which I'll provide the link for below. I'm going to start by introducing the process of thrombus formation in the venous system. As in platelet aggregation, this pathway is triggered by the exposure of blood to unfamiliar substances. The exposure to collagen triggers the activation of factor VII, which goes on to activate factor IX, which along with its cofactor, factor VIII, forms the intrinsic tenase complex. Blood is also exposed to tissue factor, which activates factor VII, which along with tissue factor forms the extrinsic tenase complex. Both tenases are activated by calcium and subsequently activate factor X, which along with its cofactor, factor V, forms the prothrombinase complex. This converts prothrombin to thrombin, which converts fibrinogen to fibrin and activates factor XIII. Fibrin monomers bind together to form fibrin polymers, which are converted by factor XIII to a fibrin mesh. Anticoagulants are drugs which disrupt this pathway and therefore prevent the formation of a thrombus. The first anticoagulant I'm going to discuss is heparin. Heparin is a glycosaminoglycan which binds to and activates the enzyme antithrombin 3. By inducing a conformational change. This allows the enzyme to inactivate thrombin as well as factors 9, 10 and 12. As discussed, all of these factors, and in particular thrombin, play a key role in the coagulation cascade, and their inactivation will therefore significantly decrease the rate at which the coagulation cascade will occur. However, the drug has been shown to induce an antibody-mediated immune response against platelets, which can cause heparin-induced thrombocytopenia, or HIT. For this reason, low molecular weight heparin, or LMWH, has been developed, which has greatly reduced the incidence of HIT due to its smaller size, rendering it less able to evoke an antibody response. Next are the factor X inhibitors. These drugs have similar pharmacology to heparin. The drugs of this class which are delivered by subcutaneous injection, for example fondaparinux, are actually based on the heparin active site. Like heparin, these drugs activate antithrombin, mediating the inactivation of both thrombin and factor X. The orally active analogues, such as rivaroxaban, however, inhibit factor X directly. These drugs produce very few adverse effects due to their high specificity and have been shown to be superior to even low molecular weight heparin, which is widely thought to be the gold standard treatment for preventing venous thrombosis. Both heparin and factor X inhibitors inhibit thrombin indirectly. However, direct thrombin inhibitors are also used as an anticoagulant therapy for the prevention of venous thrombosis. This class of drug directly blocks the active site of thrombin, preventing it from converting fibrinogen to fibrin and thus preventing the formation of the fibrin mesh. These drugs, including heparin, have been shown to have a higher potency than heparin with fewer adverse effects and are expected to replace it in many clinical situations after the completion of various clinical trials. Another anticoagulant therapy used for the prevention of venous thrombosis is warfarin, a vitamin K antagonist. Despite their name, these drugs actually inhibit the enzyme vitamin K oxide reductase. This enzyme is responsible for reducing vitamin K, allowing it to activate clotting factors 7, 9 and 10. When this enzyme is inhibited, vitamin K remains in its oxidized state. This means the clotting factors remain in their inactive precursor state. This decreases the rate of the coagulation cascade and therefore decreases the likelihood that a venous thrombosis will materialize. Although there is a relatively high risk of major hemorrhage with this treatment, this is easily remedied by administering vitamin K itself. Another class of anticoagulant, which is currently undergoing clinical trials, is factor VIII inhibitors. As discussed, factor VIII is essential in forming the intrinsic tenase complex required for factor X activation in the coagulation cascade. In phase 2 trials, factor VIII antibodies have been shown to decrease activity by up to 90% without increasing the risk of hemorrhage. Phase 3 trials are currently underway. Thank you for watching this video. If you found it useful, please give it a thumbs up and subscribe to support this channel so I'm able to keep creating this content. I'll be back with more pharmacology videos soon.